All right, so hello everyone. I'm just waiting for the room to clear up. My name is Maxime. Glad to be presenting to you today. I'm going to talk about clinical biology and the application of AI and digital solutions for this very, very interesting branch of medical care. So I'm the CEO of DPR. We're a young French startup building clinical decision support tools using AI for, as I said, clinical biology. So I will give you a brief overview of what we are doing, and then I will focus not on a business use case, but more on a medical use case to illustrate how we can improve medical care using our technologies. But first, I'd like to convince you of something. What I'd like to convince you of is that in laboratory tests lies one of the biggest opportunity to improve medical care using AI. Why is that? The first reason is that laboratory tests are a key tool for medical care. So it's a cornerstone of diagnosis. It plays a role in more than 17% of medical decisions. And it's the highest volume healthcare service. So in France alone, you have 120 million tests annually. And each test has within it maybe 20 to 30 data points. So it's super high volume. Plus, it's tabular numerical data, extremely prone to treatment by algorithms. The second point is that the data that's present within laboratory tests is often underexploited. So we estimate that more than half of detected anomalies within lab reports are not explored. And when they are explored, often it does not necessarily follow the official guidelines in terms of complementary prescription. And despite those two aspects, it's a field of healthcare that has been not that much addressed by AI and digital transformation, which has focused more on, for instance, medical imaging, ECG, EEG, and so on, but not that much on laboratory tests. So when we combine the three aspects, this is why we have the, let's say, conviction that there is a massive opportunity to bring AI support to laboratory tests, which is one of the key players in healthcare decisions today. So I just start by describing very briefly the current patient pathway for laboratory tests. We focus on not on the hospital, but rather on routine care. So the patient comes to the lab for testing. The results are generated by the lab and sent to the physician. And then the physician analyzes the lab reports, either when he has the time to do so, or when the patient comes back. And we identified actually 3 pain points in this process. The first one is that the results, no difference is made according to the urgency of the lab reports. The second one is that the physician, unfortunately, often lacks the time to properly analyze the lab reports and select the right complementary tests. And so, finally, the complementary tests are either not done or done much later, which require that the patient comes again for a new sample. So, when we saw those pain points, we decided to build a set of algorithms that we conceived with and validate a panel of experts in medical biology and healthcare. And so what we are able to do is to prioritize lab reports so that we can send alerts for the highest priority ones, to provide automatic analysis and interpretation to save time and give a security net to the physician, and finally, to make sure that the right complementary prescription is sent to the lab, ideally allowing to do some sampling optimization as we go much faster than the classical pathway. So we can, in some cases, do the test on the same sample. And we expose that through a digital platform. So this is like what we do in general. And so the use case I'm presenting is on a very, very known anomaly that you can detect in lab reports, which is anemia. So if you speak with medical doctors, they will tell you, anemia, it's super easy. I've done that all my life. I know it by heart. So we have run a retrospective analysis of more than 10,000 lab reports from clinical labs in France. And we focused on the reports and the patients we presented an anemia. And what we did is that we compared the prescription that were done in real life with international and national guidelines, what is recommended. And what we saw is that despite anemia being very frequent and very well known by medical doctors, more than half of the patients didn't have investigation of their anomaly. And when it was the case, so as I explained at the beginning of the talk, more than half led to actually unnecessary tests while missing some of the recommended tests that could have led to the right diagnosis based on the initial anomaly that was detected. And actually, so this is like a retrospective study, but the use case I want to present to you, because it's one that has, at the inception of the company actually, is a real use case that illustrates this retrospective study. So we have a patient called Mr. D, which is like in his 50s. He has no major health issues. He comes to his lab for a routine checkup. And an anemia is detected on the lab report, but for many reasons, so lack of time by the physician, or just, you know, like he didn't even saw the result coming because he's drowned under the tens and tens of reports that come every day, the anemia was not detected. But actually the story doesn't end here, because 1 year later, the same patient also come for a routine checkup, but this time, the anemia is much more severe. It is catched by the doctor, and after further investigation, it leads to a diagnosis of colorectal cancer with a very poor prognosis. And actually, retrospectively, so this is a real use case that one of the doctors of the team encountered, and actually, they catch him at this point when he presented himself with the diagnosis of colorectal cancer. And actually, they built back the story, and they realized that 1 year ago, actually the problem and the information that could have led to the diagnosis was already present in the first routine checkup. And so the way we want to transform and improve medical care, for instance, in this specific use case, so I will give you the alternate version when using the technology that we are building. The alternate version is that when the anemia is detected on the lab test, we automatically send an alert to the physician because it's something that should not be overlooked. As we are able to automatically analyze it, you can just in one click identify the correct set of diagnoses that could be indicated by the anemia, including the colorectal cancer. And finally, with another click, he could have sent automatically the right complementary test directly to the lab, which could have led 1 year earlier to the right diagnosis and to a better prognosis for the patient. Voilà. So to summarize what we are proposing, so this was a very, very specific use case on anemia, but we cover more than 60 different type of anomalies across various medical specialties. What we are developing is a first-in-class AI system to automatically interpret laboratory reports. So the specificity of our approach is that we have designed and validated all of our algorithms with a set of medical experts, so either in biology or in medicine, which makes each of our AI decisions backed by a source of medical knowledge for which we have the references. And second, we have also built a digital platform so that we can bridge the lab with the physicians, exposing the right information and not disturbing too much the workflow of the physicians because we know it's something we don't want to do. And we can guarantee that the right info, so in the story that I told you, the fact that the anemia could have been a sign of colorectal cancer that we could have taken in charge earlier, is popped up directly to the physician and helps improve medical care. So thanks a lot for your attention. Glad to take some questions here or understand if you want. Yes.
So, do I understand well that you use rules behind the facts, or
Yeah.
like deep learning?
No, it's so basically we are doing AI, but in a very classical sense. We are using expert system. I think it's my personal opinion. I think if you want to have an exhaustive system that covers like routine medical care and that is adopted by physicians, you have to provide info that they can relate to. So if you come with a deep learning algorithm and you don't really know why you make the recommendation, I think it's very hard to give that. Whether in our cases, we don't claim to do better than a very good set of physicians. We claim to do the same, which I think is very, very good if you can automate it. But I think it's super important that each of the recommendations that your AI system does is linked, as I said, to a well-trusted source of medical knowledge. So it's not just something that we, as a small startup, are providing. It's like a reference by health authorities that the doctor knows and trusts.
Thank you.
Thank you.